Today we're going to demonstrate how to use Mepilex Lite with SafeTech technology for the prevention of pressure injuries underneath a CPAP or BiPAP device. The size we're going to use today is a 4x4 inch dressing or 10 by 10 centimeters. The order number is 284190. First, I'm going to take the dressing out of the package, and you're going to see that there's a brown side or tan side and then a back side that has two films for application. Before we get started with the cuts, I want to tell you a little bit about the dressing itself. It's again a very thin foam dressing that can be used underneath a BiPAP so that you can get a good seal with the low profile of the dressing. But it also has, more importantly, an adhesive that's made from SafeTech. SafeTech is a soft silicone that actually attaches to the hills and the valleys of our epidermis and designed to be very gentle on the skin and removal. In fact, in clinical research, it's clinically proven to reduce skin stripping and blistering when you remove the dressing. So that's a very important thing, especially when we're dealing with pressure injury prevention. We don't want to cause another injury by taking a dressing off. So it's very safe. And if you've never tried a Mepilex on your skin, I would highly recommend it. If you're new to nursing, never had a dressing on, definitely take the opportunity sometime to put it on so you can actually feel how gentle it is. So next what we're going to do is we're going to actually make the cuts with a Sharpie on the dressing. So go ahead and get your guide out for the CPAP or BiPAP cuts, and then we're going to Sharpie the areas. So first I'm going to make the lines for the nose, and then I'm going to make the lines for the forehead, and then we're going to make the lines for the chin. Okay, and then after you're finished, this is actually what it should look like. And the more you do this, the better you're going to get at it. You won't need to look at your templates. You'll just know exactly what you have to do. But the templates are available to you. They're laminated. They're on the carts with the little metal rings. So if you ever need to look at it or maybe teach one of the other nurses how to make the cuts, the templates will be near the nursing station. So next what we're going to do is we're going to date the dressing. I like to date it before I make the cuts. It's just easier to do that. And we need to date each area that we're cutting. So we'll date the nose portion and the forehead and then also the chin. The dressing has a 7-day wear time, and not each area may stay on that long. That's why it's important that you date each one instead of just one area, if that makes sense. And next I'm just going to make the cuts. First we'll do the nose. I'm just going to cut these little half moons out, is kind of what I call them. And this template really does a good job of fitting most patients. If you follow this pretty well, you shouldn't have to deviate too much, although I will say every mask is different. So you definitely want to make sure that you're looking at your mask and making sure that the mask isn't sitting on the skin, but sitting on the foam dressing. So this is for the nose. We'll apply that in a second. I'm going to make my cuts for the forehead and chin next. So this cut will be for the forehead and the chin. So we got 3 pieces that came from one 4x4 dressing, which is very cost effective. So now we will apply the dressings. Now, another reason for the nose, some people will ask me, some of the nurses will ask me, well, why don't we just make a little cut like this and put that on the nose? Seems pretty easy and simple. The reason why is because the more surface area of stick of this adhesive that you have, the greater chance that the dressing will stay on longer for you. And the benefit to you as a nurse is it's less dressing change time, less nursing time. But the benefit to the patient, more importantly, or just as importantly, I should say, is the fact that it's protecting their skin. It's not moving or adjusting. So we like to make it more surface area. So now we're going to apply the dressing, and I will show you how this looks after we get it all kind of in place. And you definitely want to, it's very easy to adjust the dressing so that it's not coming in contact with the eyes. So it's right underneath that eyelid. All right, and then we'll apply the forehead. Again, just make sure whatever way you apply it, it doesn't matter if it's up or down, but just making sure that the mask is sitting on top of the foam and not on the skin itself. And then we'll apply the chin. And the reason why we're covering all three of those areas is because it's, as you know, the face doesn't have a lot of subcutaneous tissue. It's very thin skin. So all of these areas have been known to have redness, erythema, and sometimes even worst case scenario, pressure injuries. So we want to make sure we're preventing all areas that come in contact with the mask.